Hello everybody and welcome to Ovarian Cancer Australia's Information and Support webinar. My name is Anne-Marie and I'm one of the coordinators for the support programs. Before we begin, I'd like to acknowledge the traditional owners of the land that we're standing on, and I pay my respects to their elders past and present and any amongst us today. I would also like to acknowledge the Brockhoff Foundation for providing us with the funding opportunities to deliver this project. Today's webinar is Communication and Cancer, talking to your treatment team and loved ones. You can ask questions of our presenters by typing into the chat box, which is located at the bottom left-hand side of your screen. Your questions will be answered at the end of each speaker's presentation. Please keep in mind that our presenters can address individual medical cases. If you have particular questions, you are welcome to call the Ovarian Cancer Australia Information and Referral line. Today, we are very excited to welcome our presenters, Catherine Hodgkinson and Denise Firth. Dr. Catherine Hodgkinson is a clinical psychologist with over 18 years' experience in client care, research and education. She has a long-standing interest in women's cancer care and works in the hospital-based gynecological oncology service for 8 years. Denise Firth was diagnosed with breast cancer in 1988 and ovarian cancer in 2004. She's had surgery, radiotherapy, and numerous chemotherapy treatments. Denise is passionate about women sharing their experiences, support and informing each other. She happily gives insight into what has assisted her along her journey. I'd now like to pass you over to Dr. Catherine Hodgkinson to begin. Thanks, Catherine.
Thank you very much, Anne-Marie, and thank you very much for the invitation to talk. So we all know optimal, so I'm just locating the first slide. We all know optimal healthcare delivery requires really good communication. So in this session, I'm hoping to cover how best to discuss our concerns and our questions with our healthcare team, have a think about ways of talking about cancer with your family and with your loved ones, and that includes the children in your life, as well as some ideas about talking with and sharing your experiences with your wider set of social networks and at work. I work as a clinical psychologist, and it's a surprising amount of time is actually, in my appointments, is often devoted to this topic. It's tricky. Communication doesn't come as naturally as we all hope, but it's really important to get it right, not just through treatment, but through recovery and at other points in our care. One of the things about communication, and one of the things that makes it tricky, is that we really can only provide guidelines. There's no prescription, unfortunately, that works for all situations. So we need to apply the information with flexibility, and we need to really think about planning, seeking advice and reflection on what's helpful, what's been helpful in the past, what others have tried, as well as thinking about what we can try differently next time. I've had the privilege of working with many women and families affected by ovarian cancer over the years, and so a lot of the information I'm sharing today is based on what I've heard them talk about that's been helpful or not so helpful, as well as thinking about what the research tells us about communication. So the first point, it's tricky. Effective communication is a two-way process. But it's the basis of all good relationships in our life. Being able to say what we think and what we feel and being heard and understood is absolutely vital. But it's complex and it can go wrong. Often when we're discussing things that are personal, things that are very emotional, things that are controversial, or when there's uncertainty, we've all, I'm sure, got many experiences of when it doesn't go quite as smoothly as we hope. But the good news is as patients and health professionals, we both have a role in what happens and thinking about how to actually help this process. And over the years, psychologists and other health professionals become much more involved in thinking about communication skills and trying to navigate this area. So a lot of the medical programs now involve a lot of training on communication skills, so that hopefully health practitioners are getting better at managing it. So let's have a think about the multiple communication channels that exist around you. So if you look at yourself in the middle as the patient, if you can see on your screen, there may be children, there may be a partner in your life, there may be your oncologist, GP, nurses. There's a whole load of different people in your social network, as well as different people in the medical care team. And some of these will talk to each other, some of them won't. So there's a lot of people involved. Many of them will be new to you, and you'll often meet at a time of crisis. But also, when we look at the communication between those different people, there's often many filters that work, and this is through words and through actions. So there might be differences in language, in culture. There might be differences in non-verbal communication, words that are chosen, people's attitudes or expectations, as well as filters as far as what information we want to hear or what information we're comfortable discussing. And obviously many filters can work at one time. And there's many barriers that can get in the way of this simple process of delivering and hearing a message working effectively. So let's have a think firstly about communicating well with your team. As we said at the beginning, it's essential for the delivery of best practice. There's a legal and ethical underpinning to that, because our medical team need to provide information that we understand, and this is often needed with when we're making complex decisions. And it often ensures safety, but even survival at points. So it's absolutely fundamental to good care. As patients, people see it as critical to good care, to being understood and cared for, and being treated like a person, not just a number. We want up-to-date information. We want the right information at the right time, so that we feel confident that we're getting the best care and we're getting the best outcomes. And so there's guides through different states as far as for the healthcare professional on how they should deliver care, but there is also guides as the patient on your rights and responsibilities. And I think it's important just to flag that we also have a responsibility to communicate openly with our team, to share information, to give them updates. So although I think sometimes we can feel that we're bothering the doctor or being a pest, we might be asking too many questions, we actually have a responsibility to communicate openly and well with our care team. But it's tricky, isn't it? There's many barriers. And just having a think about these, the most obvious one is that a diagnosis of cancer is a life crisis for most people. It can be a very emotionally challenging time, and it can be very challenging at different points across your care. So we're not always in a good place to be thinking about what skills we should be using or how to communicate. We may be in pain, we may feel quite overwhelmed, exhausted, have chemo fog on board. We might have waited for a long time for the appointment. We might not have had particularly positive experiences with medical care in the past. So we bring all of this to our expectations about our conversations with our medical team. The other thing we know is there's a lot of research saying even of what is communicated in a appointment, we often only remember or recall a small percentage of that. Often the information is very complex. Often information can change and sands can shift, and this can be really quite difficult to accommodate when you're on the spot and dealing with so much. Families and who are maybe in attendance at the appointment might also not agree on what information they want, what their priority is, or how open they are to discuss different topics. So that can make it hard. And just like any relationship, we might not always click with our particular medical practitioner. These are just an example of some of the things that patients will often report. Often, I don't want to be a burden or worry them. People are often aware they might have waited in a busy waiting room. There's lots of other people that aren't very well, and they don't want to take a lot of the doctor's time. So people are often very considerate of that, but also very concerned about not wanting to be seen to be complaining, or they may even think, look, if the doctor thought it was important, they would have raised it themselves. So we obviously have a whole lot of chatter in our heads that gets in the way of, which is another barrier in how we communicate. So we know that it's tricky. Let's have a think about some tips about what might be helpful. Fundamental, planning your appointment, thinking about preparing for your appointment. So things such as the timing of the appointment, things such as taking a support person with you, even things that, such as, making sure you have food on board, you're hydrated. We know that we'll often have to wait to see someone. Trying to actually manage our stress levels during that waiting time, particularly if we're aware that this might be quite a significant conversation we're going to have. Preparing a list of questions, I'm sure many of you do, and is really helpful. Think about prioritising what the important questions are, and trying to stay to the point as well in the consultation. There's various bodies have put out question prompt sheets to help guide you on what questions might be useful, and things such as decision aids can also be helpful in trying to guide your questions. Other suggestions is when you're actually in the appointment, writing down answers or asking for written information or copies of diagrams, trying to educate yourself before about the sort of jargon that might come up, the sort of procedures or words, so that you feel that you're going into the consultation with some information on board. So trying to think with your communication skills, how to be specific, using I statements, asking for clarification if you don't understand, and maybe feeding back what you've heard to clarify your understanding. If in the appointment, if you are overwhelmed at particular points or distressed, you're probably not going to take on much information. So even asking for a pause or some time out, thinking about how to manage your emotions, how to manage stress, and that can be helpful, having support people there as well to be able to have a second pair of ears. Sometimes communication doesn't go as planned, relationships don't go as planned, so thinking about talking with your GP about how to access other sources of information. Think broadly about your care team, who else you can ask. Also, thinking about second opinions or accessing other resources. And there's bodies out there such as healthcare complaints that can help patients navigate when communication doesn't go as planned. The end of treatment is often quite a tricky time for people, and often a time when anxiety rises. It's often a time when people are processing what's happened, but also what does this mean for my future health. So thinking about communication, particularly at that point, getting information, making a plan, what you can do to improve your future health and reduce the risk of recurrence. Understanding what surveillance means to you, rather than the other women that you may meet in the waiting room who may have had different recommendations. Knowing what symptoms to look out for is really important, and what can be done about them, so that every ache and pain doesn't trigger the alarm bell for you. There's also things such as survivorship care plans which have been put out, which are really a record of your treatment and thinking about your forward care planning. And so there's various ones of these. There's ones available through the Peter Mac Survivorship Centre in Melbourne. There's other things online, and I know in the ovarian Cancer Australia Resilience Kit, there's a section in the diary for actually recording your care. So moving on, thinking about communicating with our loved ones, again, the barriers. Often our loved ones and our relationships will be deeply affected by the cancer experience. We will often want to protect others. It's very, very tricky thinking about discussing upsetting news with other people that we love. And the information is often complex. And as we mentioned before, there's often uncertainty, so that they're quite difficult messages to get across. Everyone has different information needs and responses, and there's often myths as far as communication. We mentioned one of the ones before, which is, communication comes naturally. Often the one in relationships is, the people in my life should understand what I need or know how to respond to me. That it isn't always that smooth. And of course, there's practical barriers. There might be fatigue, there might be a lack of time. We may have had a relative move into the house to help care for small children. So there's just not a lot of opportunity for time to communicate well. So thinking through how we communicate with our loved ones, again, preparation, finding a time, setting the scene, maybe sending a warning shot, saying, look, there's some difficult things I'd really like to talk with you about, or I'd like to bring you up to date on what the doctors are saying about how my treatment's going, maybe talking about small things, asking questions, trying to understand their understanding and what they want to know is really important before we proceed to provide information. Listening actively, we hear a lot of people talk about that with our body language as well as our ears, and then feeding back to them what you've heard, what the discussion has been, and working out where to go. Obviously, the fundamentals, showing respect, trying to work out how to manage our emotions, thinking about not just words as a means of communication, but touch or hugs or smiles, and keep working it. It's not always going to be successful the first time. So humour and just taking the trouble to rethink, maybe getting some advice from others, sharing with others through support groups, through peer connect programs can be really valuable. When we're thinking about another area of the final area of communication, those in our broader lives, a lot of people say this can cause a lot of distress. People's comments, many of them might be unsolicited or unasked for, but often can be quite distressing for people. So, and some of you might relate to some of the bubbles that just went up. So thinking about taking control with others, thinking about planning ahead, being assertive, thinking about if conversations are too confronting or personal questions, how to respond to them. And sometimes people come up with their own little phrases like, look, thank you ever so much for asking. That's really kind of you. However, I'm just trying to focus on, enjoying the dinner tonight, or, I'd love to make it another time so we can have coffee and chat about that. So feeling that you can put some barriers up to stay in control. For some people, if that there's someone else in their social network that's newly diagnosed and they feel is leaning on them heavily, taking some control, or with the horror stories. Someone once shared this for me, which as soon as everyone, other people would say, oh gosh, my aunt had that, and rah, 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 she'll just put her hand up gently and say, look, I just want to stop you there, only do stories with happy endings. So just a very gentle way of being assertive, using a little bit of humour so that you don't then end up avoiding social opportunities because you can't deal with 1,000 questions when in actual fact you just want to hear about each other's grandkids or catch up and just have some fun outside of the cancer world. So the last topic I'm going to cover is talking to children and young adults. And these may be your own children, they may be neighbours, or they may be a whole range of other children in your life. What we know is cancer is very much a family illness. It has a ripple effect on your family, but also in your social world. And the children around you are often pretty curious. They're often pretty smart and perceptive, and often seem much smarter than their years would indicate. But if we aren't able to communicate them in a way that's appropriate for their age, they're probably not going to understand what's going on. They're probably going to draw their own conclusions, and these may be quite different to what's actually happening. So the trick is trying to balance avoidance with confrontation with communicating, and the balance of honesty and trust. So it is a really tricky area. Often our instinct is to really try and protect people. So being aware of our own feelings and barriers, being sensitive to when children or young adults may want to talk, so watching out for cues, listening and accepting their feelings, and providing reassurance. There's many things we can reassure the children in our life, and one is that they will continue to be loved and cared for, and to talk about what isn't going to change. So being honest, gentle and hopeful. We've talked about appropriate language, trying to avoid euphemisms because they probably won't understand what the hell we're talking about. Being aware that this is really, and often talking about health, just like we talk about sex or drugs, it's an ongoing conversation that we have, and there's no one chance to do it perfectly. We'll also probably need to repeat information and introduce new information over time, and it's quite okay to say, look, that's a really good question. I'm not sure of the answer to that. I'm going to ask my nurse, or I don't know, but I'll find out and we'll talk again. So there's, as I said at the beginning, some very general suggestions for how you might talk to children, to loved ones, to other people in your life. There's a lot of resources out there that can help you. The cancer councils have great booklets talking to kids about cancer. They have great resources for school communities as well. We at Headway Health, we developed a resource on communicating effectively with your healthcare team, which is on our website. Ovarian Cancer Australia have got a number of resources. Sometimes people will find it helpful to talk to someone outside of the family, and there may be a social worker and there may be a pastoral care worker through your treatment centre, or you may wish to access a psychologist. Medicare provides support for access to private psychology services through GP mental health care plans. So your GP, as always, is a really important person to talk with and access about all aspects of your care, as well as the emotional aspects and as well as the, how to navigate this within your wider life. I've put up a list of websites that have got some helpful material on that you might want to look at. And again, always important to be really careful about the information that's out there and to go to reputable services. So I'm very happy. I'm really looking forward to hearing Denise's talk, and I'm very happy to, for myself or for both of us, to take questions or comments. So thank you, Anne-Marie.
Thanks very much, Catherine. That was really very interesting. Thank you very much. So I'd just like to welcome any questions from people who are participating in this webinar. I have received a couple of comments earlier via the registration process, and I've put that into the chat box. There's a comment from Brenda. She talks about empathy versus sympathy, and being on the receiving end of sympathy and pity when all you want to do is be seen as normal.
Yes, that's a really good comment, and I guess that really sort of fits in with some of those comments I put up in the little the sound bubbles before about how, you know, people often don't know what to say, and sometimes they'll, you know, it will come, although their heart might be in the right place, sometimes that will come across as quite unhelpful or disrespectful or demeaning. And a lot of people will talk very much about, wanting really to contain the impact of the cancer in their life. But someone recently said to me the expression, the cancer has to live with me just as well as I have to live with the cancer, but trying to actually not let it define you, and trying to maintain as much control in other areas of your life and to be as normal as possible is really important, and that's certainly something people talk a lot about. Yeah.
We've had a question, thanks for that, Catherine. We've had a question from Jeanette Trevor. She says, what does one say to one's oncologist when one is changing to another hospital in the same city?
And so I'm wondering, is that in the context of not being happy with care?
This is the question we received this question during the registration process.
Okay, yeah. Look, It's tricky, and I guess everyone would have a different view. I would certainly know some patients would just move their care and ask for their notes to be transferred without providing any feedback. Sometimes people, especially if it's been a longer standing relationship, or that they might wish to have a discussion, and yes, those discussions can be quite difficult. I guess I would see that the oncologists, as we said at the very beginning, some of them, have a different levels of skills in this area. Sometimes receiving some feedback or suggestions about what might be helpful, sometimes people feel that that's valuable and that might actually benefit future patients, even though that person may not feel a good match with that particular doctor. So it is a tricky area to navigate.
Yes. Thanks, Catherine. Annette B has just commented that she thinks it's better to ask a person, do you feel as good as you look today? Rather than always saying, you look well, which then negates your chance to talk.
Yeah, that's fantastic. And I've heard other patients that they say, the question is, do you feel as well as you look today? Because there's a lovely complimentary nature to, I can see you look well, but also you're acknowledging that it may have taken quite a bit of effort to get up, to get the lipstick on, and to be presenting in this way today. And yes, it doesn't shut down the conversation about what's really, really going on. It's very much an opener and a way of providing permission to say, well, actually, having a shocker today. And then you can see whether that other person is willing to continue the conversation and actually be a support person to you.
Thank you, Catherine. Do we have any further questions from participants before we move on to our next presenter? If you do have a question, as I said, please feel free to type your question into the chat box on the bottom left hand of your screen. And now I'd like to invite Denise Firth to share her story. Denise?
Hello. Thank you very much, Anne-Marie, and thank you very much, Catherine. You've given lots and lots of insight, and I think I'll probably be repeating a lot of it here. Well, as I had already been said, I was diagnosed with breast cancer in 1988, and after a mastectomy, I required no further treatment. And out of the blue in 2004, I was diagnosed with stage 3 serous ovarian cancer. After a radical hysterectomy and 1 round of chemotherapy, I thought I was cured. But then, now 12 and a half years later, 1 regime of radiotherapy and 3 more of chemotherapy, I'm living with advanced ovarian cancer, which is a nasty, insidious disease. But I'm very privileged at the moment to actually be on a targeted therapy on olaparib, and I'm actually going to strength to strength. Obviously, on this 12 and a half year journey, I've learned a lot. From the outset, I've had a brilliant gyno surgeon, Tom Jobling, and on our very first meeting, he told my husband and I, if you were my wife, this is the treatment that I would be suggesting. This is the operation that I would be suggesting. And that really has more or less formed the basis of the philosophy of the treatment team that I have. Tom sent me to his colleague and also a friend, Gary Richardson, who had the same values. Basically, they treat their patients as if they were loved family members. I feel truly blessed to have them on my side because they're compassionate, expert and very caring. They see me as an individual as well as a wife and a mother, and they care for my whole family, and all decisions that are made in my best interests. I feel that my specialist team has really created a nice little nurturing nest where I feel protected and in excellent hands. During my journey, I've had thousands of blood tests, procedures, MRIs, PET scans, CAT scans, operations, blood transfusions. My veins collapsed, surprise, surprise, with that much chemotherapy. A portacath had to be introduced. And then, lo and behold, I became allergic to 2 of the chemo drugs. But I've always tried to stay positive, and I've always had complete faith in my specialist team. When I was first told that I had chemotherapy I had to have chemotherapy after my hysterectomy, I was devastated. I'd seen the ravages of cancer and chemo in my family with my sister, my mother, and my grandmother and a maternal aunt. I was determined I wasn't going to be counted in their number. Unfortunately, they all died. So I asked a million questions. What drugs would be going to be used? What the time regimes, length, side effects, what to do, what not to do, etc. All of my questions were very patiently and thoroughly answered. And if I was unsure about anything, I'd sort of say, well, what do you mean by that? Or are you actually saying, so that I had clarification. It had to be very clear in my head because I was making huge decisions. I also, from day one, have carried little notebooks, and here they are. Every single question that I have ever wanted to ask any of my oncology team are written in those books. The date, time of my appointment, and that particular question. Then, on the appointment date, guess what? Comes out, asks the question, and I write a response beside it. Basically, that's so I've got a record, I know what the issues have been, and also when I'm driving home with my husband, I don't say, hey, Greg, what did Gary actually say about that? We've got the information there in black and white. I've never, ever had a question that has been even seen to be irrelevant or a waste of time. They've always been answered honestly, and rarely do I ever need clarification, simply because my oncology team and my oncologist, Gary, don't do doctor speak. They speak to me in terminology that I can understand. Often, as Catherine suggested, that I've actually asked for printed results, so for blood tests or scans or whatever else. So I've got those printed results. I actually keep a record, and it's in my Gary file, and it's my right, it's your right, and basically don't accept a refusal. If you feel your specialist team aren't treating you with respect that you require or deserve, then, or that you're feeling a little overlooked or overwhelmed, you know your body, you've got the right, and if this team isn't to your liking, then find a new one. Get a second opinion. For us, it's a matter of life and death. You have to be proactive, and you've got so much to gain and so very, very, very much to lose. But having said that, I've always been 101% confident and content with the team, and I consider myself very blessed that they're on my side. If there is anything that you're worried about or concerned about, then ask. Remember, no question is so trivial if it's any way caused you a sleepless night or any worry. You can be almost 100% sure that if you've got a question, somebody else that oncologist or that nurse or that doctor has seen has also been asked that question. They'll have a response. Remember, worry will not cure anything. And as somebody told me, worry is like a rocking chair. It gets you nowhere. Also, please don't blindly use Dr. Google as your go-to resource. If you've got to look up symptoms, tests, information, then please, please, please use reliable resources. Ovarian Cancer Australia, BRECAN, Cancer Council, and the whole range of ones that Catherine put up there, all list reliable sites. Likewise, each of these groups have brilliant printed as well as online resources, telephone counselling and information sessions that are open to all. So use it. On that, I highly recommend the Resilience Kit from Ovarian Cancer Australian. Okay, use these organisations. They're fonts of knowledge, and knowledge is power. To make any decision, you need accurate and up-to-date information. Empower yourself. It will help you to cope, because trust me, there's nothing worse than that not knowing. That's what causes you worry. So ask. Also, your oncologist, your hospital, your oncology departments all have written materials about operations, procedures, etc. Take the material, read it. If you don't understand it, highlight it. When you go back for your next appointment, take it with you and ask. Ask for clarification. Ask what it means. No matter how vague, also, side effects. They often seem to be very, very trivial, and you think, oh, okay, write them down, because trust me, if you put the frequency, the severity, and the date beside each of your side effects, what you're going to be doing is, again, you're going to have a record. At your next appointment, ask about them. Your specialist team needs to know what's happening in your body. They have got no other way of knowing by you being honest and upfront, and therefore you're in control. For instance, I once developed these really weird welts on my abdomen and bruises on my arm. I didn't think anything of it. I thought I'd probably been out gardening and rubbed against something, but put it in my trusty little book, and guess what? When I spoke to Gary, the next appointment, Gary, what do you think this is? He looked at it and he said, well, Denise, he said, you're actually allergic to gemcitabine. If I had gone through that day to have day oncology, to have yet again more gemcitabine, I would have been in dire straits. So, even though it seemed insignificant, in actual fact, probably in some ways it saved my life. Also, your specialists should have a registrar. If for some reason you desperately need to speak to your oncologist and can't get through, ask to speak to the registrar. They work with your specialist. They have got access to your medical records, and they are an excellent source of knowledge. If they're unsure, they'll get to the bottom of your problem and return your call. Likewise, as Catherine was saying here, if you're any apprehensive about your appointments, and I must admit, even after 12 and a half years, I tend to get a little bit anxious when I go and see Gary, even though he's an absolute delight, because I think, will I remember things, etc., etc. Take a family member with you, or a really trusted friend, someone who'll support you. You'll gain confidence with someone by your side, all right? Having said that, I have never been to any of my oncology operations, any of my appointments, without either my husband or my daughter by my side. And I consider myself very, very privileged to have that happen. Also, we as a family, and I've only got a little family, my husband and my daughter, Greg and Sky, they make decisions with me. They come to my specialist appointments, they ask questions, and all of their questions have always been honestly, compassionately, and answered with reasoned responses. Likewise, when it came to genetic testing, we were at a BRECAN session, my daughter and I, and Claire Scott was speaking, and she convinced Sky in that session that genetic testing was the way to go, as there was a very strong connection between breast and ovarian cancer, and there was a very strong presence of it in our family. And that Claire said she thought it would be valuable. So Sky and I had the discussion, and along with Greg, we decided, yep, this was a good thing to do. So in June 2014, surprise, surprise, I was tested positive to BRCA1, but to my great, great joy to this very day, and my great relief, Sky tested negative. It was a very hard conversation for us to have, but it had been a vital one for her and her future. Likewise, when I was first diagnosed in 2014, my husband, who is an absolute delight, took on the task, unbidden by me, of informing our family and friends that I actually did have ovarian cancer. As you can imagine, there were many tearful telephone calls both into and out of the house. He was from that time on my filter. He'd answer the phone and by gesture or charade inform me as to who the caller was. Then by my facial expressions he would know whether or not I even wanted to speak to them. He was my protector, my shield, and from those days, even from those days when I couldn't even face getting out of bed, let alone going through the saga of well-meaning questions and chatter. I've always tried to be very honest with my friends. I've always tried to tell them the truth, and I'd sort of say, I just couldn't speak to you yesterday, but I'd ring them the next day and say, chat, chat, chat. I've not needed to be brave, and I've never made excuses. If I was feeling fragile or exhausted or confused, then I'd say so. And just because I'd made arrangements to do something, And I sort of felt, it's the last thing I feel like doing today. I'd maybe change or modify the situation or the activity, or just cancel it and say, let's do it another day when I'm feeling a little more chipper. If they're good friends, they'll understand. If they're not good friends, if they don't understand, then maybe they're not such good friends after all. Everyone always wants to help, always wants to do something. Sometimes all you really want to do is just be left alone, but get them to do things that you know you're going to have to do anyway. Maybe it's picking up the kids from school, maybe taking you shopping, maybe making you a cake, I don't know, doing your ironing. Get them to do something that you really hate, I suppose. They'll feel really involved, and you've got a task that's completed. As I said, we have a very small family, and there were very few children when I was initially diagnosed. So discussing my cancer wasn't a real issue with them. Their parents chose, again with my blessing, to tell them that I'd had an operation, that I was going to have medicine to take, and that medicine may make my hair fall out, but that it would grow back. All these questions were honestly answered, and the children were given enough information sort of to satisfy their curious minds. So I really didn't have any huge input into that. This was what my family and my friends did with respect to their children, and it worked well. I was still at school as a teacher when I was initially diagnosed, and my principal, who was also a very personal friend, took on the role of telling the staff that I was on extended sick leave and required surgery. Those who were closer to me at school knew that I had ovarian cancer, and that they were very supportive and caring, and organising for my return. The students were informed again that I was on sick leave and that a replacement teacher would be found. The juniors, that probably didn't matter too much, but particularly for my Year 12s, there was much sort of concern because it was later in the year when I actually had my first recurrence, years later in the year, but years later when I had my first recurrence. So my Year 12s were very, very concerned about me. But we have a school counsellor and a welfare counsellor, and she dealt with the situation along with me very well indeed. We've all got fears, and there are a million myths and stories about cancer. Everyone, no matter who and how well-meaning they are, has a story to tell, whether it be horrific about someone who died this dastardly death, or feel good. They've all got advice to give us as to how we should or could deal with our cancer, what will cure our cancer, whether it be exercise or food or various remedies. I deal with this, and probably not as kindly as Catherine would, but I deal with this by saying, thanks, that's great, I'll look into that. But basically, I ignore any advice, irrespective of how well-meaning it happens to be. Okay, but I do love Catherine's idea of her friends saying, I only listen to stories with happy endings. I think that's going to be part of my repertoire now. Mm-hmm. We're on a journey. You, your family, and all your close friends, all of you are affected by cancer in a different way. You have a specialist team who are guides, who are leading you through this journey, but you still make the decisions, okay? The more information you have, the easier it is to make informed choices. Cancer doesn't change who you are, but it gives you a new normal life. Live your life to the full. I've never spent much time worrying or feeling sorry for myself, and I really try the whole time to be very positive and upbeat, making the most of every moment. I never waste time, and I have always made the most of the here and now. I exercise regularly, and I'd love to say I eat a really healthy diet, which I probably do, but gee, I also eat the naughty things and drink the naughty things as well. So, look, basically I eat and drink whatever I desire. I look forward to tomorrow, and I suppose really I feel so very, very grateful that I'm living in a time where medical science and research is discovering truly wonderful new treatments and hopefully diagnostic tests and even cures. And I saw the ravages that my family have gone through, and I thought, oh, if only my mother and my sister and my aunt and my grandmother had lived now, they'd be here by my side, which would be wonderful. In closing, I must say that I'm truly blessed by having a wonderful husband and daughter who've been with me for every step of this journey. I doubt that I would be here now without their unstinting love and support. I honestly believe that it has been much, much harder for Sky and Greg to go through this journey with me than it has been for me. I love them both dearly, and I would be absolutely lost without them. So thank you all for listening. I hope that I've given you some helpful hints and that maybe your journey might be a little less stressful and a little easier. So thank you, and now back to Anne-Marie.
Denise, thank you so very much. That was fantastic. That was just inspiring. That was very moving.
Thank you.
Thank you. There's a question or two that's popped up. Somebody's asked what kind of medication you said you were on. Did you say it was olaparib?
Yes, olaparib, which is basically a PARP inhibitor, and it's a very, very clever little drug. And what it does is only kills the DNA in the cancer cells. So I've been on it now for about 20 months, and I've never felt better. It's absolutely brilliant, and hopefully, fingers, legs, everything else crossed, it will be on the PBS very soon, and therefore everybody who's in my situation will be able to have it prescribed, because at the moment I'm getting it compassionately from AstraZeneca, but at the moment your oncologist can prescribe it for you, but it is it's very expensive, and it shouldn't be. We should all, look, I feel incredibly privileged that I'm on it, but every woman should have the right to be on this drug, because literally it is a lifesaver.
So, Denise, can I ask, how did you find out about olaparib?
Basically, I went to one of my normal appointments with Gary, and if any of you happen to know Gary Richardson, he handed me this paper. He said, sign it, Denise, I'm importing drugs for you. And I went, oh, okay. So I signed away, and after I'd signed away, he explained about what olaparib was, how it was going to work. I had previously heard about it through David Battle and also Claire Scott through various BRCAN and Ovarian Cancer Australian sessions. So I knew what a target therapy was. I had heard this name bandied around, and when Gary said, it will work, I had to tick lots of boxes. I had to have BRCA1. I had to know that my cancer was going to be controlled in some way by platinum, as in carboplatinum, and I had to have sort of what they call sort of advanced ovarian cancer or recurrent. So once I ticked those boxes, Gary said, okay, this is it. And as I said, I've been on it now for, must be almost about 20 months, and it's been brilliant. So ask your oncologist about it.
Thank you. Fantastic. Thanks, Denise. Catherine, there's a question here for you. The question asks, you mentioned assertiveness, and if it doesn't come naturally, do you have any more specific tips on asserting yourself with doctors, friends, etc.?
Yeah, look, that's a really good point. I mean, it's very easy for me to sit here and say be assertive, but we're all different, and we all come to this with different levels of comfort around this, and obviously really hard to learn new skills and new habits at probably one of the most stressful times of our lives. So I really acknowledge that comment. So when we're thinking about assertiveness, maybe start by thinking about what's your message, what do you want to get across, so be very clear about this. Think about using I statements and I would like rather than you, the sort of statements that start with you. So think about a very clear message starting with I. Then maybe with family or people around us, we can actually, we could write it down and we can actually rehearse saying it. And this might be just like we might practice going for a job interview. We might sort of practice actually vocalising it and saying it. And just give it a go. It might be helpful, as you said before, to have a support person with you. It might be that your support person is someone that is able to actually ask the question for you. But afterwards, review what went well, what didn't go so well, what could you try next time. And I think really giving yourself a pat on the back, acknowledging what worked, is really helpful as far as building your confidence to be more assertive next time. So all the communication we're talking about, they're skills, they can be learned, but it takes practice, and sometimes it does take going out of our comfort zone. Again, if we just did a quick little search on the internet, how to be assertive, there's some, quite, again, being cautious, but there can be little tips just as far as how we might wish to communicate. Run it past someone in your life that you feel gets that balance right between not being too pushy or aggressive or being too passive. So get some support.
Thank you very much, Catherine. Now, do we have any further questions from participants to either Denise or to Catherine? Well, thank you for attending today. Just as a little reminder that the webinar recording will be available next week on the Ovarian Cancer Australia website to view on demand. So indeed will the slides from Catherine's presentation today. I'd like to give a really big thank you to everybody for attending today's webinar, and I'd like to thank Catherine and Denise. It was very informative and inspiring presentations you both gave. Thank you very much. We really appreciate the time that you put in. We value the effort that you've given today. If everyone could stay on the webinar platform for just a few more minutes, and we'll direct you to our online survey. And a final shout out for OCA, who have launched a new and improved online community forum. OCA Connect is a place where you can join with other women with a cancer diagnosis or an ovarian cancer diagnosis, to have conversations, seek support, advice and information, and you can go to our website and follow the links. Once again, thank you, Denise, and thank you very much to Catherine, and we'll see you at the next webinar.
Thanks.